Our topic today is innovations and advances within physical medicine, particularly within the rehab field. So we're going to talk quite a bit about physical therapy because that's what I spend my time doing. Just to have a little information about me, I'm a physical therapist. I work at the Cleveland Clinic. I've been at the clinic for about 2 years. I obtained my doctoral degree from UNLV about 3.5 years ago. I have since had advanced training in Parkinson's disease and multiple sclerosis and in neurologic rehabilitation. And it's a great opportunity to be able to speak to you guys today. So if you have any questions, I welcome them as we go. We're going to go through a little bit of some basic information to start with, tell you a little bit about our rehabilitation department here at the clinic, and talk about some of the things that we do that are advancing care, particularly within the neurodegenerative populations that we see. So let's see if my little clicker works. And there we go. All right. So at the Cleveland Clinic, first off, we are a not-for-profit organization, and the building design itself was designed by Frank Gehry. If you haven't taken a tour, which most of you probably have since you're in it, all right, take a look around. The building is built to symbolize hope, is actually what it was designed for. And it opened in 2010. Give you a timeline within the rehabilitation department. Our physical therapy department opened in 2011, and our occupational therapy department opened in 2014. We have 10 neurologists on staff that serve our 3 different disease areas, looking at brain health, demyelinating diseases like multiple sclerosis, as well as movement disorders like Parkinson's disease. All right. We, as a rehabilitation department, have 6 physical therapists on staff, as well as 2 occupational therapists, again, serving all 3 of those disease states. Our mission as a Cleveland Clinic, as well as the rehabilitation department, is to provide the best patient care possible, and for particularly within physical therapy, is to optimize functional mobility and minimize fall risk. Our occupational therapy emphasis is a little different. We're looking at optimizing ADL function, which is activities of daily living, as well as IADL, independence. IADLs are independent activities of daily living that have a little bit more to do with how we function day to day and are more like driving and things like that. Yes, as our occupational therapist can tell you, they're about keeping yourself functioning well, keeping your house functioning the way it should. All right. So they also provide, our occupational therapists provide cognitive rehabilitation and compensatory strategies to cognitive impairment. And we can get into more detail about that as we go on. Particularly here, again, I told you I was giving you some background. For our rehabilitation department, you can get a hold of us through the main line on the 6000 number that's listed on the screen, or you can get a hold of our scheduling department through the number that's listed here just below. In order to start therapy of any kind, we need an order from one of our providers here at the clinic, and that your insurance will approve coming to see us at the clinic. There are a few insurances which will not, and they're listed there below, and sometimes we can work around that. Again, talk to your doctor, talk to our schedulers, and they can help you if it's something that you feel you need to go further with. All right? So let's get into why we're really here, which is to talk about advances in the technology and advances in therapy in general within the neurodegenerative population. I'm going to use our clinic as an example here. And these are some of the pieces of equipment that we have in our clinic that have been able to help us advance our care. The key thing with any advancement in care is that those who provide it know what to do with it, is the most important piece. And we'll talk a little bit about that, but we'll start with what some of the technology is. And if you have any questions as to what it is or what we do with it, please just raise your hand and we'll jump right into it, okay? So the first one we're going to talk about is, we have this big list here, we'll start at the top, okay? C-Mill Gait Training System. This is a big fancy treadmill that does all sorts of fun stuff that I'll show you. All right, it allows us to train people in a different way than we could just on ground and put them in more real life scenarios to be able to help them learn more quickly. And we'll talk a little bit about that. We have overhead suspension systems that work to provide safety and also to take away a little bit of the fear sometimes when people are doing things that are challenging and they're worried they are going to fall over. All right? In order to change, sometimes we have to get out and do things that are uncomfortable. If we want to stay the same, it's really easy to do that. You do the same things you've always done. If you want to change, sometimes it takes branching out and doing things that are a little less comfortable.
Is that an actual treadmill?
The one that's in the picture?
Yeah.
Yes, it's about 15 feet long, and it's a virtual reality treadmill. That's actually a picture of the C-Mill gait training system. And I have some videos of that we'll show in a minute. It is, there's only, as far as I know, there's only 2 in the United States, and the other one's at Boston University. And so it does a whole bunch of fun stuff we'll get to in a minute. Yeah. So we also have a few functional electronic stimulators. And these are used primarily for our individuals with MS and allow them to be able to change their walking to be able to achieve a more natural walk. Again, I have a couple videos that will talk about the way these devices work and what they allow us to do from a training perspective. All right. We have what's called a video nystagmography, which is a big fancy word that basically means I have some piece of equipment that allows me to track how your eyes move and is particularly useful with people who may have dizziness, vertigo, or are having trouble with particular eye movements. All right? And we use this quite a bit. As you can imagine, if your eyes aren't doing what you want them to, it's very challenging to keep your balance because you don't know where things are around you. All right? And that's really where we come into it. We have some more standard equipment that works with some strengthening and some endurance type activities, such as pulley machines and aerobic trainers, all right? And you'll see some of those at some of the newer fitness centers as well here in town. We promote heavily boxing here at the clinic and its effect particularly with Parkinson's disease, and we're starting to see more of the effects with some of the cognitive disorders as well, with really pushing high intensity, big amplitude type activities such as boxing. All right, just happens to be one way that works really well. There's all sorts of things that work really well. Boxing tends to be one that works great. We have a couple other devices that help, particularly our folks with MS, when they start to struggle with trying to move forward. And one of those is our hip flexion assist device. And I'll show you some pictures of that. We'll talk about the way it works. And the last one is one that's coming soon. And it is a device that we anticipate using a lot for research, which is a mat that basically goes on the ground and allows us to see how someone walks and gives us all sorts of information numerically about how their walking is and what's different about it from person to person. We'll talk about why that's important when we get there. So, first one, talking about this big long treadmill that we have, all right? It is a virtual reality treadmill, and it has been shown to have greater effects changing walking than walking on the ground, just training your walking on the ground, or walking on the treadmill, or doing standard therapy. It is something that allows us to take someone and put them in different scenarios that are much more similar to what they face in real life and also much harder than they face in real life in a very safe way. So some of the things that are particularly helpful is that it allows us to do dual task training, which means doing multiple different things at the same time, multitasking that we always talk about. All right, allows us to do that with walking and something else, or do multiple different things while we walk, or change the way we're walking. All right, it provides us visual targets to help modify the way people are walking, which is something that's hard to do with walking. You'll see why in a minute. And it allows us to promote adapting your walking to what's all around you. All right, when you're in a cluttered environment or a busy environment or you're in a crowd, you need to be able to change and adapt to what that is. And this is a device that kind of helps us work towards some of those things. This is a device that actually uses game-type technology to do it in a little bit more fun, a little bit more interactive way, which is very helpful for people with cognitive impairment because it's intuitive. It's something that feels very natural to do, whereas sometimes trying to change your walking doesn't feel so natural when you try and change something about the way you walk. All right? It also allows us to do simple and rapid testing of advanced balance and gait patterns. In a way that's very quantifiable and a way that we can come back and check for progress. So, what this all means is I've got some videos to show you about the way that this works. And let's see if I can get my mouse over here. Okay, so see if I can make it a little bit bigger here too. Okay, so this first program that we're going to see, so the treadmill actually has a projector that goes with it. All right, as you watch the video here, what you'll see is it actually projects targets for this person to try and step right onto, those little boxes. All right, those boxes are adaptable. We can change them to try and make someone step longer. We can do it to just match their walking to try and help them keep consistency as they walk. So you can see we can also put in obstacles that they have to avoid as they walk to be able to get them to adapt to their environment and be able to help them learn how to keep a consistent pattern. All right. Before it moves on to the next one. Yes. Okay. Let's move on to the next one. And I have a few of these just to kind of give you an idea of what this technology allows us to do. All right, so this next video shows a similar type program. It again projects onto the belt of the treadmill to where the person's walking, and it gives them an obstacle to avoid. So this starts to work on real-world scenarios such as busy, cluttered environments, stepping over and around objects that may be in your way, recognizing that they're there and doing something about it. All right. And where did my mouse go? Okay. Our next one starts to put you into a more complex environment. So this program, again, will project onto the belt of the treadmill. This time it gives you targets and obstacles in random locations. So this is a much more complex task, but it does it in again, a very simple way to be able to try and get you to adjust to what's around you. Now, I have one problem with these videos. They're all holding on. Okay? When we're walking, we're not normally holding on, and that's actually one of the big things that we push in therapy, is that we need to be able to get you to adapt and use your walking in a way that progresses you. This isn't about walking by itself. It's not about balance by itself. We have to use all these things together because that's how we really move. All right? And as you can see, going around over obstacles trying to hit a target forces you to change and adapt to your environment. And that's what this device is really all about. One more video here. And this is a program that goes on to, you can see on the, well, before I start talking, let's make sure it comes up. Okay. You can see that the treadmill has a big video screen at the front. All right. This program actually goes onto the front screen. There's a few different things we can do with that front screen, including more of a virtual reality walking through different environments type. This one is actually a type of game that works on a very key skill, which is weight shifting and the ability to shift from one foot to the other foot. This is not just balance, but we do this every step we take. And putting this into game format again makes it very intuitive and very easy for people to follow. Besides all the fun things that this does for the individual, this also spits out a whole bunch of information to us and tells us very specifically how your performance is. So that when someone comes in and we do this one time, then we do it maybe 3 or 4 weeks later, we can then see and assess how progress is being made, if we're seeing the changes that we want. All right. Well, that didn't stop. Okay, so the key thing that I love about this system, and I don't have a video for it, so I did my best I could with pictures here, is that it promotes dual task training. This is what happens to us in real life. I don't know how many of you walk around thinking about your walking no matter what you're doing. I know I don't. I tell people all the time, when I think about walking, I say walk once and then I walk. All right? When something's going on within our brain that starts to disrupt that pattern, your brain needs to use attention to keep yourself walking. So you start thinking about 18 million different things that all keep you walking. Problem is that your environment's really busy. And there's things going on, there's loud noises, there's flashing lights, there's all sorts of other things that grab your attention. We want you not to be able to function no matter what's going on around you. And that's where this dual task training really comes in and keeps people safe, because it allows you to train yourself to be able to function and not fall and not stumble and not stutter and not shuffle when other things take your attention away. So this device does this in several ways. A couple of them we've already seen, which are it forces you to adapt to your environment. Even just adapting to your environment is a way of dual tasking. All right, forcing your brain to pay attention to more than just how you're walking. It forces you to pay attention, oh, I need to change my walking. All right, very simple way of starting. We can also do that by just giving you guides. So if you see in these pictures, and I'll move over here so you can see, all right, there's a little pathway that they have to follow. Or they have to follow a really narrow pathway. All right, another simple way of starting to get the brain to process a little bit different information. All right, we can also put you on a normal walking track. So things like a street that has a whole bunch of garbage and junk in it. All right, and you have to process what can I step on, do I have to avoid, and as you do that, it takes your attention again away from, okay, am I just focused on my walking? My favorite task is one that's a lot more challenging. All right, it is a task that requires you to be able to process different information than anything to do with walking, and it's one like this one that you can see up here on the left. All right, if you start reading these colors on the screen, you notice that the color matches up with the word. All right, as you get farther down, you start to notice that it says a word, but the color isn't right. All right, and that gets challenging for our brain to be able to process which piece of information do I want. All right, something you can try is you can try and tell me all the different colors that you see and don't tell me what word it is that you see. When you do that, it forces your brain to have to process multiple types of information, and it does it very quickly. All right, doing that while you're walking takes your attention completely off your walking. It lets me see how it is when you are completely distracted out in the environment. And it also lets the person practice a real-world scenario that's really quite challenging, but our brain does this all the time. Even though it may not be with these words and colors, it gets very distracted and very occupied with our environment. All right, and this is one way that we can practice that. And our treadmill actually gives us the opportunity to do this while people are walking, while they're changing, and while they're doing things in their environment. Okay, do we have any questions about that? Did I answer your question kind of about how it functions? Okay.
How important is it to swing your arms when you walk?
So the question was, how important is it to swing your arms when you walk? It's quite important. As you walk, one of the ways that you help keep rhythm and you help keep your balance is by having your arm swing. Your arm swing actually helps you to take a longer stride, and it also helps you to keep a more rhythmic stride. So it will allow you to go farther, faster, and more efficiently, is really what your arm swing does.
So is that something we work towards on this thing?
Yeah, so the question was, is that a piece of what we work on this machine? And that is. Every aspect of gait we try and work on. So as we get farther along, it starts off with, okay, can we get the mechanics working? Can we get your feet doing the right things? As that gets better, we absolutely get into things like arm swing. That's why I pointed out, I don't like people holding on if I can help it. We want to work on balance. We want to get the mechanics of walking like you're not on a device. All right? Again, a treadmill is a tool. In order to get better at walking, we can't just use that, right? That's not real world. We have to kind of get off it, but it allows us to practice things and carry over in a way that's very, very applicable to the real world. And that's what we try and get out of it, all right? Any one tool by itself doesn't give us everything, all right? And that's why we need multiple different tools, and it's all about the way that you use them, and it comes back to the people who do it, and they need to know what they're doing, all right, to be able to help the best way that they can, all right? All right. Moving on to the next one. So we're going to talk about a little bit about a couple different devices that are functional electrical stimulators. These work particularly for our population with multiple sclerosis. These people sometimes get to a point where they have a really hard time picking up their foot. If you've noticed people, and this happens to people outside of multiple sclerosis as well, they'll have what's called a drop foot, where they go to move their foot forward and their toes just stay down and they drag right along the ground sometimes. Or they trip and they stumble. This is something that's very difficult to walk with. It becomes very challenging and expends lots of extra energy that these people don't have to begin with. All right? Now, it is one of the best ways to use a device like this, is one of the best ways we can change their positioning and keep their walking pattern as fluid and natural as possible while maintaining balance. It's one of the latest ways of keeping the foot to function the way it's supposed to. I have a couple videos here, and this first one kind of shows the way that it works, so it kind of gives you an idea of what actually happens. And this is about one of our two functional electric stimulators here. I'm going to turn on the volume so you can hear.
The NES L300
Okay.
foot drop system consists of three main components: a lightweight cuff that fits below the knee, a small gait sensor placed in the shoe, and a wireless control unit, all of which communicate wirelessly, eliminating the need for troublesome externally worn wires and connectors, making the system simple and easy to use. While walking, the patented gait sensor detects the position of the foot and transmits wireless signals to synchronize the electrical pulses delivered by the stimulation unit on the leg cuff. The pulses from the leg cuff activate the nerves stimulating the muscles that cause the foot to lift off the ground at the appropriate time during gait. The wireless control unit allows simple operation while displaying real-time information regarding the system's status. Get in step with the latest breakthrough in gait rehabilitation. Enjoy the freedom of walking more naturally with the NES L300 foot drop system.
Okay, so it kind of gives you just a tiny little bit of background of how that works, okay, and what it does to change the way that people walk. I like to give you a real example, all right? And this is a real example that'll you'll be able to see the change in what happens quickly.
I was diagnosed 37 years ago. I used to run 5 to 6 miles a day. I started limping, and it just slowly, over time, it got to where I couldn't even run a step. And I always tried to hide my limp, just to go to the mailbox. Before I wouldn't. I mean, in the mailboxes across the street. I don't want, someone coming out in the front yard and, hey, do you need some help? People standing in front of a restaurant looking at you is like, hey, what's wrong with him? I was very self-conscious about that. So I was fitted with a brace. I know the benefit of it is to keep your toes up, but it keeps your ankle stiff. It keeps your foot stiff so you don't have any flexion in your ankle. I found out about the L300 on the news. So we tried to find, well, where is this? How do I find out about this? And it wasn't until I moved here when we first tried it on, and I could not believe it. I mean, when she had her little Palm Pilot and my foot was going, that I didn't know it was even possible. And then when I started walking, I went, oh my God, I have to have this. The stimulation from the unit, when it activated my foot, when it kept it up, didn't bother me at all. We worked on the adjustment, a little tweaking, till we found the perfect spot. And I can always, with my little remote, I can either make it stronger or make it weaker. The L300 has changed my life completely. Instead of being homebound, which I would have been, and now I'm out in the public and proud of it. I can walk a lot further and a lot longer than without, no doubt. And with the L300, you have movement in your foot. It helps me with my balance. That's another thing that I worked on. The L300 was half my leg. Okay, so now I got the thigh unit. So now I have a complete leg.
Let's see.
On the treadmill.
All right, let's see if we can get out of here now. So just, again, real world stories, kind of bring it back home a little bit. And you can see the value in devices like this that allow someone to be able to regain a motion that their body will no longer provide for them. And so it's an adjunct to some of the therapy that we do, is to be able to use devices like this to be able to further the performance of the body and then train them in how do you move within this new motion. Now that you have this, how can we get it to be even better, even more efficient, which is all the name of the game. All right.
Excuse me, Jason?
Yes.
If somebody had a stroke and
Yes.
this would be a temporary that they could use for foot drop, and would their muscle memory come back probably quicker?
So the question was, with stroke, is this something you could use and would it help to bring back, the word was muscle memory, more quickly? Yes, a lot of the research that has been done with these devices has been done on stroke. And within stroke, there's very good evidence for learning with these devices, and meaning that your brain learns how better to control this muscular movement. Within MS, the evidence is still unclear as to whether it's a learning process or if it's more of just a device that allows you to move better. It's just a different process going on in the brain than a stroke. A stroke is something that happens once and your brain starts to adapt to it and figure out how to deal with it. Multiple sclerosis happens many, many times, and your brain has to adapt to each new episode and change with each one. So it absolutely can be something that's learning. I think there's very good evidence for it, but we don't know how far that goes with some of the diseases we deal with here yet. And that's one of the things we hope to find out in the future. So, any other questions? We're going to keep talking about these, but are there any other questions before we keep going? Okay. So, the other device that we have that does this is the walk-aid system. These two systems are the top two on the market, and they do essentially the same thing. They work in a slightly different way. So I want to point out the key differences. And if you know anyone who's considering these, or if you are yourself, it will help you to be able to differentiate between which one you need. So the key difference is that the walk-aid works without shoes, which is quite convenient. All right. The BioNest device only works with shoes placed. All right. You can only works when you're wearing shoes. However, the BioNest happens to be very adaptable. It changes based on your fatigue levels. It changes based on how you are walking at the time. Whereas the walk-aid is pre-programmed and can't adapt to your walking as it changes throughout the day. So for people with multiple sclerosis, if you find you have a lot of fatigue, sometimes the BioNest is a little bit better because as you wear out a little bit and your walking changes, the device will change with you. If you find yourself walking barefoot all the time at home, well then maybe the walk-aid's a little bit better for you. And it just kind of depends on individual needs and how they respond to the different devices, but they work very similarly, which is why I didn't add more videos, because they're essentially the same. They both work to lift the foot when you don't have it. They're working on developing technology now that works on other muscles in the body. Okay, they have available devices that work on the thigh, so both on the front and the quadriceps that kind of keep us standing, as well as in the back on the hamstrings that bend our knee to allow us to move forward. The other one that they're really working on is an implantable device that would help with hip flexion. And maybe down the road we'll see if something like that ever happens. But it would be a big help to people who really have a hard time moving their leg forward when they're walking. And one of our other devices works on that too. All right. So this is our video nystagmography, all right, which is a big fancy word for tracking eye movement, basically is what we're looking at here. So to keep this one very simple, again, it works on people with balance deficits that stem from their head position, as well as vertigo, or really difficulty moving their eyes where they intend to, or having a hard time seeing the environment around them, all right? So it's basically a system that uses a computer, a TV, and a set of goggles. The goggles have little infrared cameras in them, and the computer uses software to be able to track where your eyes move as different things are shown on the TV monitor and to see what your eyes do. And there's lots of different things we can do with this to be able to test the function of what is known as your vestibular system, which is a little system back here. Sometimes people talk about it as the balance system in your ear. All right, it's kind of the neighbor to your ear, and it tells us where our head is at in space. And when there's a disruption within that system, it causes all sorts of terrible things, including vertigo, including really bad balance. All right. And with some of the things we see here within the neurodegenerative population, we see broken up communication from this system to the brain. And this is a way of diagnosing what's going on and finding the right way of treating it. That's because as we get into different areas of the brain that are disrupted within that communication, we do different things. All right?
Is that what makes a dog throw up in your car?
There's lots of different reasons the dog could throw up in your car. Car sickness can have to do with this. It doesn't always. Motion sensitivity is very common with things where you don't know, where you can't feel the motion around you. And so this system's job is to make sure that your eyes stay focused in one spot even when your head is moving. So the example I give is if you're looking like this and you turn your head real quick, you want to keep your eyes in that same spot. If this system's not working, your eyes go with your head, and then they jump back. Okay, because your brain knows you want to keep looking at it, but it doesn't know how to keep them there until you stop moving. All right, which makes you very disoriented when you're trying to move around and you turn your head, or you're in the car and the car's bouncing, everything's bouncing. All right, and it gets very draining. A lot of times people get headaches, they get vertigo, they get nauseousness, all these terrible symptoms that come along with it, but you don't have to have that to have a problem that's in this system. All right, sometimes it's just that my balance isn't good. I don't feel like my equilibrium is what it used to be, and sometimes we find that there's problems within that system that have led to some of those things as well. Any questions, other questions about this? I don't know if I have another picture or not. Okay, away we go. So this device, I said that we had a device that helps move the leg forward, that they're working on an implantable electric device to do this. This is the interim. This is the one that works in the meantime. It's a little bulkier than a device that's inside the body, but this is what's called a hip flexion assist device. It's a big, basically rubber band that goes around your waist and then down to one or both of your legs and attaches to the front of your shoe. Now I'm going to step forward so everyone can see, so that when you get your weight off your foot, it makes it pop right up and forward, okay? Particularly within our population of people who have multiple sclerosis, this becomes very important because they really lack the ability, as the disease progresses, to be able to lift their knee up and forward, all right? This device does that for them. It, by nature of where it attaches as well, it also helps them lift their toes up a little bit so that they can not worry about dragging along the ground as they go, okay? Questions there? Away we go. Our newest technology that's coming soon, which is a mat that looks very much like the one that the gentleman in the picture there is walking on. Looks like a wooden floor. What it does is it has little tiny force sensors all throughout it, and it actually plots for us a picture much like this one, and then spits out a whole bunch of information about the way someone's walking. And this becomes really interesting to us as we get into the research of what we do here at the center. We know, particularly with cognitive impairment, that walking impairment starts before the cognitive impairment does. That means there's little changes in the way that someone's walking before their thinking or their brain starts to really have noticeable changes, all right? So this is a way that we think that we can get to trying to get people diagnosed sooner, be able to understand the way they're walking and use that to be able to dictate, well, maybe this might be going on. And in conjunction with imaging and medical assessments and blood tests and everything else that we do here at the center, to be able to get someone a more rapid diagnosis so they can get treatment more quickly. All right, and that's really where we hope to go with something like this. Any questions? All right. We're going to talk a little bit about our occupational therapy department, and particularly within there, we're going to talk about the technology that they use or will soon be using for their driver's assessments. So a new service starting how soon, Shayna?
Probably very soon because we we just got the approval, and so then we have to just meet with a few of the doctors and discuss that with them, and then we'll start scheduling appointments.
So
Hopefully within the next month.
So hopefully within the next month, we'll have driver's assessments available for anyone. And the idea of this is to give someone the opportunity to go and test their driving skills and everything all the capacities they need for driving in a very safe way, so that caregivers and the individual can know if they're safe to be driving, all right? That's the idea. It also gives you an opportunity, if there's areas that you need to work on, you can figure out what those are and what you need to do to work on getting better at it, so that everyone can maintain their safety, all right? So there's a list of a couple things here that they use. We're gonna focus particularly on the driver simulator and what's called the UFOV, all right? And you'll recognize that when you see it. Well, I don't have a picture. You'll recognize what it is when I talk about it, all right? So the driver simulator looks very much like this. It's a desk with a big array of monitors that surround you, with a steering wheel and all the controls of a car. And it allows you real-world driving scenarios, including ones where there aren't a win scenario, where you will have to either go off the road, hit something, run into someone, or things like that you couldn't do in real life. It allows the therapist to be able to see how your reactions work to things like that, how your thinking works, what your reaction speed is, and how you choose to make difficult decisions, all right? It's also a very good way, as you can imagine, of working on improving cognitive skills, because driving is something that requires a lot of brain capacity. There's a lot of information coming at you when you're driving, and as you get going faster and faster, that information comes at you faster and faster. And so this is a tool that they can use for that as well. All right, the UFOV tests visual field. So, you know when you go to the DMV and you stick your head in the little visual thing and they start flashing lights at you? This is a fancy one of those, all right? It allows us to test very specifically how your vision is, and if you can see the full visual field, which you can imagine, that's important for driving. You have to be able to see everything around you and be able to process it. So, it's very interesting to note that just within the general population, the useful visual field shrinks as we get older. So if you notice, by the time that you're 80, about half the drivers have very impaired visual field, all right? And that's just generally. As we start to get into neurodegenerative disorders, there's good evidence to suggest that that's significantly higher. And so it's something to keep an eye on. And our occupational therapists are a great resource to use when you have any questions or concerns with you or your caregiver or anyone else you know about their driving and whether or not they're safe. Okay? Any questions about that? Yeah?
So, it sounds like awesome. I mean, because you might be able to use it as a reality testing for either a patient or even a caregiver.
Mm-hmm.
You know, maybe do baseline and then.
Yep.
So this is going to be for the public to be able to come in and use, or I mean.
I'm not sure on that one, Shayna. Is it for the public?
We might eventually get that way, but right now it's going to be more patients of ours that we're seeing, just because we have access to their information. And right now, even in general therapy, we usually have to have a recommendation from one of the doctors here. And this will not be a driver rehabilitation program, which can happen, you know, like if you have a stroke or you have something that your brain can rewire itself and get better. This is going to be a driver safety program, so it will be a good tool for people who, like Jason was saying, are wondering if your family member is not safe to drive any longer, or if they are, what are some things to kind of keep them as independent as possible, but when they need to be checked again. Because in this place we work with people who have progressive disorders, so there's no research that shows that you can rehabilitate for driving in a progressive population. So it's more of a safety thing, like you are okay right now, but you'll need to start planning, and then we'll be helping with planning driver cessation. So when you cannot drive any longer, how can you still be independent and everything?
So you basically have to be a patient or a caregiver of a patient here?
I think initially is what we're planning for, just until we kind of get on our feet a little more, and then we might start opening up to the public.
Okay. Yeah, it's a great program, and it really is something that's vital to the center, because that is a very challenging topic. And so this is a nice way of being able to give very quantifiable data that says, hey, you're better than we thought, good to go, or hey, no, it's just bad enough that you're really not safe anymore, which is a very valuable information to have. Okay. So, as I started off with saying, before we got into all the technology, the most important piece is that the technology is used the right way, and that those people who do it know what to do with that technology and then know where to go from there. What we do in therapy isn't always high tech. Sometimes it's very low tech, but it's used in the right way to promote the right response. And so as a center, this is just a little background on us as a rehabilitation department. We have 2 neurologic specialists here at the center, 2 of the 3 in the state of Nevada, okay? We have 1 geriatric specialist. We have 2 vestibularly trained therapists, which deal with kind of that dizziness and the vertigo that we talked about before. We have 5 multiple sclerosis certified specialists. We have 1 dementia certified practitioner, and we have 7 therapists with significantly advanced training in Parkinson's disease. We try and cover everything we do with a lot of specialty. All right, we spend time to try and know the very best techniques and the very latest evidence to be able to support any new advances and find any new technology that can help within our populations here. And that's the key to why, as a center, we've been able to advance the treatment of some of these conditions, because we stay right up on the cutting edge of everything we do with our training and with how we get our information. Here at the center, we do individualized care. We spend time one-on-one with our patients, which is absolutely vital within this population. It changes the way people respond when they can have somebody standing there with them, helping them understand what they're doing, why they're doing it, and maintain their safety while they're doing things that otherwise wouldn't be safe. Which at the beginning, like I said, to affect change, sometimes it takes that. Sometimes it takes getting uncomfortable. Sometimes it takes getting a little unsafe, but in a safe way. All right? So, besides that, we also do caregiver training, family training, to be able to help people who take care of individuals to know best how to do that. We work on year-long management. So oftentimes insurance companies will not cover seeing a therapist forever and ever and ever. That's just not practical. We work on trying to manage it so people know how to manage their own condition on their own throughout the year and see us like a doctor for checkups, to be able to make sure that what they're doing is still effective. All right? So within our practice, a few specialty areas where we spend quite a bit of our time. We talked a little bit about caregiver training. We have community exercise classes, 2 twice a week that we hold here at the center. We have Rock Steady Boxing that we've joined in conjunction with Richard Steele's boxing gym. If you're here, gosh, almost 2 years ago, I talked about this in one of our lunch and learns then. We've developed an MS exercise video, an MS informational video that talks about things you can do when you are initially diagnosed with MS or in the later stages to be able to maintain exercise, and almost can work like an exercise program that you do at home. We have power wheelchair evaluations for people who need them. We now have the driver's evaluations like we've talked about. Functional capacity evaluations are coming soon, and these are used to be able to determine people's ability to continue working or if they need other services to be able to help them with. We are also, in the last 2 years, have developed our clinical research program. We have 1 study that has been completed, and we are middle of another, and we've got another one coming up very soon. And we are very active in understanding further what's going on with these conditions and how physical function really plays a role, and how it changes the brain chemistry of what goes on in these different conditions. Yes?
Where is our, so the MS exercise video, where is that available?
You know, you would be the person that I would have thought to ask about where that MS exercise video is available. I know it's been, is it in the library? It's in the library, there we go, okay. And it was one of the things that our department really helped spearhead and lead out and understand that, hey, this is something that's absolutely vital for that population. So, going hand in hand with our clinical research, little promotion for our fall screening that's coming. This is another opportunity for us to gather information, but it's also an opportunity for all of the community. This one's available to anyone. Patient, not a patient, caregiver, not a caregiver, anyone. To come and gather information for themselves about their risk for falling as well as their memory. All right, this year, we are going to have at the center fall risk screening, memory screening. We're going to have pharmacists so you can ask questions. We are going to have information about current research trials that are ongoing. We are going to have information about the Healthy Brains website that I'm sure you've heard about if you've been here at Lunch and Learn. And we're going to have information about a fall prevention class that we hold at least one time every year here at the center that's available not just to patients and caregivers again, but to everyone, and is free to everyone. So just some information. This continues to be an event that gets bigger and bigger every year, and as a center we continue to think that it's a very good opportunity to get our awareness out into the population about not just memory, but also the physical function of it and what happens as we go, as some of these things progress. Yes?
I'm just going to mention that there is a flyer on the memory and balance screening over there, and you do need to pre-register for it, and I've heard that it's almost closed, so pick that up and register if you want to participate.
Yeah, if we have anyone in...
I did it.
Yes. So if we have anyone listening, the comment was that there's a flyer and you need to sign up quickly because the spots are almost out. So if you need one, pick one up on your way out. If you need that information, let us know, okay? So and part of our advancement is also advancing the practice of physical therapy and rehabilitation in the Valley. People often feel that Nevada kind of lacks specialty within the medical field, and we are trying to change that at least within our fields. One of the ways we do is we participate in an organization called Nevada Goes Fall Free. All right, it is an organization that works on teaching people the ways that they can manage their balance, manage their fall risk, both through physical function and communication with their doctors and things like that. And it's one that it's a coalition of states almost nationwide, and they produce information and have classes and things like that, and we support that here at the center as well. All right, it's also our fall prevention class that we hold once a year is through this coalition. It's through the instruction that they give. All right, it's free to everyone. Through our community involvement to help improve the care in the Valley, we have 2 executive board members on the Nevada Physical Therapy Association. We have 2 district level chairs in the Nevada Physical Therapy Association. We have 2 Occupational Therapy Association members, and we also work to promote the education of up and coming therapists. We regularly have interns from the master's level occupational therapy programs and the doctoral level PT programs that come here and spend months at a time with us to be able to learn about how they should practice therapy within this setting. We also provide seminar classes to UNLV's doctoral of physical therapy students each spring. And we also provide lunch and learns every once in a while to teach the community about what's going on within the physical function of these different diseases. All right, that's all I have for you guys today. Do we have any questions? Yes?
You have a lot of machines in a building, and I was wondering if it would be possible for the center to get a maze so people can walk the maze at their own pace. They'd be out in nature, which has been proven to make people feel better about themselves. I just think it'd be a better environment for them.
So the question was, is there a way that the center could get a maze, or I'm going to alter it just a little bit, like an outdoor walking area track type setting? Because it is helpful. It is, again, I take most of my patients out to the garden here often, and I use everything that's out there. If you walk across it, there's all sorts of funny little things out there. I love it because it puts people in real world scenarios, okay? It's something that I think it has to fit into what the center does, but I think it's something that as a rehab department, we would love to see them go further with. And we'll just kind of see as things develop and changes happen here at the center if it's something that happens. It's definitely something we've talked about. Any other questions?
Aren't many of the machines patterned after acupuncture?
No.
No?
No. There are in other areas of therapy, there are techniques that are patterned after acupuncture. Here at the center, we don't use any of those. There isn't a lot of evidence within our populations right now to use them. There's some softer evidence in certain things, But there's other things that are a priority for us right now over those ones. Any other questions? Yeah.
Is there an opportunity for take patients on field trips? Because it's been clinically proven that if you take people out in nature, or if they just see it, a nature scene,
Yeah.
they feel better about themselves.
So the question is opportunities for people to get out in nature, like field trips or things like that. We encourage our patients to do it. We personally don't take them there, okay? We encourage our patients to, with their caregivers, with their family, or if they're capable by themselves, at least 5 times a week, they should be out doing things, okay? Particularly aerobic exercise, all right? So getting out in nature is my preferred method of having them do that. That being said, sometimes there's reasons why people can't, and there's sometimes reasons why it's not safe to. But within what people can do, there's absolutely the opportunity to get out and use everything that's available to you. Anyone else? All right. Well, it's a pleasure talking to you guys. Thanks for being here.
Thank you, Chris.
Yeah.
Thank you.